Yeah. So let us start. This is substance use disorder. Myself, Dr. P.S. Biswas. So what is drugs? Drugs are nothing but the substances which changes our behavior, function of mind. Mind consists of three things. One is emotion, one is action, and another is perception. And if any chemical changes it, that is called drug. Now, what is psychoactive substance? Psychoactive drug. That means which changes the behavior. Say, for example, an antibiotic usually do not cause any behavioral change in a human being, but alcohol cause behavioral changes, as you must have seen. Some of the substances are caffeine, marijuana, that is ganja, nicotine, LSD, cocaine, alcohol, heroin, etc. Why people use the drug? Many of you are staying in the hostel. You must be saying that people are using drug starting from cigarette, bidi, khaini, tamaku, other products of tamaku, to cannabis, alcohol. Up to this, these drugs are called gateway drugs because they drag you into the field of substance use. That means drug addiction. Then one may go into injectable opioids, then smacks, sniffing, etc. So why to start this substance? Sometimes it is experimental. Sometimes it is just to forget the problem. Fear of examination. So let us forget about it. Sometimes मजा लेने के लिए, get high. Sometimes to lose weight, to gain weight. Sometimes to relax. एग्जाम में पास किया है, एग्जामिनर को गाली देना है, नहीं तो जो टीचर खराब बिहेवियर किया है, नहीं तो जो पेरेंट खराब बिहेवियर किया है, नहीं तो जो पड़ोसी खराब व्यवहार करते हैं, नहीं तो जो बॉस रूड है, उसके ऊपर गाली देने के लिए कुछ तो हिम्मत चाहिए. एंड दैट हिम्मत is given by substance. Sometimes sleep problem that brings the substance use. नींद नहीं आ रहा है, तो let us take the benzodiazepine, and that is the start. Sometimes I am getting bored. वेकेशन में हम हॉस्टल में हैं, मेरा फ्रेंड नहीं है, क्या करें? तो let us take some substance like बीड़ी, cigarette, तम्बाकू. It is the start. To gain the confidence. Sometimes टीचर के सामने, पेरेंट्स के सामने, ऑथोरिटी फिगर के सामने थरथराते. If I smoke, if I take some substance, I get confidence. To be cool and experience altered state. Then others, like taking position in the friends. If you take alcohol, you would be in better position. If you don't take cigarette, that means you are not manly, you are not intelligent, you are not up to date, you are not smart enough. Take the cigarette in style, try to take alcohol in the party, then you will be smart. Something like that. Substance abuse. Abuse means when you are taking the substance and it had problem with your health, your relationship, your status, your work, your productivity. when you take too much, when you take too long, and improper use, obviously. DSM-4 defines when should we call a person in dependence. There should be some tolerance. That means if you are taking 2 cigarettes per day, it is enough for you. After some time, it will be 4 cigarettes, and at the end, maybe 20 cigarettes per day. That is called tolerance. Then withdrawal. If you stop taking alcohol, there would be some tremulousness in your hand. There would be some perspiration. You would not be able to sleep. These are withdrawal symptoms. And amount and duration should be longer enough to impair your functioning. Then control would be difficult. Time period. Most of the time of the day, you will be busy in acquiring and taking the substance and getting rid of it. So it is difficult, and activity and commitment would be impaired, and negative consequence in your family relationship, your friendship, your output in the job and your study, etc. So if these are present, then it is substance dependence. In short, if you are not able to control substance intake, if you feel there is a compulsion to take it, if you are not able to stop even after bad consequence, then it is dependence. Risk factor. This first point is difficult to understand. Lack of attachment with healthy adult. If you don't have adequate friend, adequate number of person whom you respect, whom you follow, then there is a risk factor. Then genetic. Family में है तो होने के chances है. Personal characteristics like high vulnerability to anxiety and depression. Those who are anxious and easily getting bored and depressed and impulsive. अभी इच्छा हो रहा है तो अभी पीना है, अभी खरीदना है. Something like this. Then health and mental illness. And gender wise, हम मेल है तो पीना है, हम फीमेल है, स्मार्ट है तो स्मोक करना. Something like this. Early drug use. पहले किया था तो अभी भी करेंगे. These are some of the risk factors. And other risk factors are availability, culture. Some of the culture, they sanction this substance use behavior, etc. Then possible functions. How it helps. It provides the role. You are a male, you are an adult, you are smart enough, something like this. Then withdrawal from the intimacy. कभी कभी होता है पार्टी में जाके अनफिट लग रहा है. I am getting bored. I cannot mix with people. So have the substance. Alcohol, smoking, ganja, opioid, etc. Then addiction to other experiences like sexual addiction, pornography, gambling, exercise, internet surfing, television, seeing television, role-playing games, and shopping. Shopping addiction is frequent in females. Sex addiction, both male and female. Gambling, more in male. Exercise, more in male. Pornography, more in male, etc. Then dependency कैसे develop करता है? Non-user. There are 4 or 5 types of user of substance. One is non-user. That means personal choice for health, social, family reason, they do not like to use it. They maintain this status. Experimental user. एक बार लेके देखते हैं कैसा मजा आता है. एक बार सिगरेट पिया तो बहुत जोर से खांसी लग गया. हाई पॉसिबिलिटी सब्सिक्वेंटली वो फॉलो नहीं करेगा, नहीं ले. एक बार लिया अल्कोहल एक पेग तो बड़ा मजा आया. इतना मजा कि कभी पार्टी में इतना मजा नहीं आया. तो अकेला में लेना शुरू कर दिया, पार्टी में लेना शुरू कर दिया, दोस्तों के साथ लेना शुरू कर दिया. सो एक्सपेरिमेंटल यूज. Then social use. You can understand from the term. You are attending some party, you are attending some birthday celebration, you are attending some uh, after passing the exam or getting married, something like this, and you are uh, getting this substance. So social use, it is available in the social circumstances. Sometimes instrumental use, pleasure seeking, avoiding pain. You will encounter in your private practice and subsequently that many of the old ladies, they take substance like steroid because of the knee pain. Many of the male persons, they take steroid because of the neck pain, low back pain. Some or other doctor have prescribed it, and then it was beneficial, so started taking for years together. So for pain killing, opioids, sometimes initially it was compulsion, doctors have prescribed, subsequently they started taking on their own. And this pleasure seeking is most important in young, like you people who are staying in the hostels. It is very dangerous, this pleasure seeking. There are so many sources in this world to have the pleasure, starting from eating delicious foods, drinking cold drinks, these substances, seeing good films, seeing pornography, having sex. Okay, so I think I'm sorry, there must be some technical problem. I have lost your connection, and now I have started it again. I believe it is okay. Uh, so next is habitual use. To start with experimental use, then habitual use. Habitual use means when you feel there is a problem in your relationship, work, health, financial matters, and legal status because of substance, then it is called habitual use. Next is compulsive use. Compulsive use means you cannot prevent yourself. You cannot prevent yourself. So, how to go about it? Compulsive use is always associated with tolerance and withdrawal that I have discussed earlier. Then binge user. Binge user means take the substance for 2 days, 3 days, huge use, excessive use, followed by not using for next 1 month, 15 days, then again using with hostility, aggression during this period of use, domestic violence, work problems, etc. So बीच में ले रहा है, huge intake with problems. These are called binge eating. I mean binge substance use. Next is recovery. How recovers? Your thinking, your action, your feeling, all these things are related with your social circumstance, your spiritual idea, all taken together will determine how you recover. Then stage, early stage में क्या होता है? You make a mind to have some change. adequate sleep, diet and exercise, and physical activities. Then middle stage, what happens? Able to turn the energies to family, work, relationship, काम करना शुरू कर दिया, फैमिली के साथ बैठ रहा है, रिलैक्स कर रहा है, फन कर रहा है, मूवी देख रहा है, जो हॉबीज है उसको अटेंड कर रहा है, उसको एंजॉय कर रहा है, मिडिल एज। देन लेट रिकवरी फेज में इंसाइट इनटू द अर्ली ट्रॉमा, कि मैं क्यों ले रहा था सब्सटेंस, उसमें धीरे धीरे ज्ञान आने लगता। दैट्स द लेट फेज। Then aspect of recovery. These are model of changes, how people changes. Go to next. Start from the below. Thinking about it, I have to get rid of it. Then preparing for the action. Then taking the action and maintaining good thing in the life. These are the 4 stages, but anytime you can go back to the early stage. Relapse. Going back to previous behavior of substance intake, that is relapse. कॉमन ट्रिगर्स फॉर रिलैप्स, इट इज वेरी इंपॉर्टेंट। कैसे होता है, फिर दोबारा चालू कैसे हो जाता है? अनप्लेजेंट फीलिंग, वाइफ के साथ झगड़ा हुआ, गर्लफ्रेंड के साथ, बॉयफ्रेंड के साथ झगड़ा हुआ, दोबारा लेना शुरू हो गया। टीचर ने डांट दिया, दोबारा लेना शुरू हो गया। एग्जाम में फेल हो गया, फिर शुरू हो गया। कुछ पैसा फाइनेंशियल लॉस हुआ, कहीं पर बेइज्जती हुआ, तो फिर से शुरू हो गया। देन लेने की मन किया, तब लेना शुरू हो गया। कॉमन ट्रिगर ऑफ रिलैप्स इंटरपर्सनल स्फीयर में, सोशल प्रेशर, दोस्त बोल रहा है ले लो ले लो, दोबारा शुरू हो गया। कॉन्फ्लिक्ट विद अदर्स, पेरेंट्स के साथ झगड़ा हुआ, एनहांसिंग गुड फीलिंग्स, कि मजा लेना है, तो दोबारा शुरू हो गया। देन पर्सनल रिलैप्सिंग फैक्टर, पीपल, पहले जो दोस्तों के साथ लेते थे वैसा ही शुरू हो गया, जिस जगह पे लेते थे वहां पर जाके फिर से शुरू हो गए, जो चीज में लेते थे, जिस पेग में लेते थे वहां से शुरू हो गए। देन जिस टाइम में लेते थे, शाम में लेते थे, ऑफिस से लौटने के बाद, जिस एक्टिविटी के साथ लेते थे, क्रिकेट मैच देखते देखते लेते थे। इमोशनल स्टेट, जब दुख लगता था, जब मजा आता था, जब फन होता था तब लेता था। इवेंट, शादी में लेता था, देन बर्थडे पार्टी में लेता था। तो इसके साथ होता है ब्लेमिंग इज ए बिग प्रॉब्लम इन सब्सटेंस यूज। हम सब्सटेंस लेते हैं इसलिए क्योंकि वो मेरे को बेइज्जत किया, वो मेरे साथ अच्छा बिहेव नहीं किया, वो मेरे साथ ठीक नहीं किया, वो मेरे को ये बताया, वो मेरे को पीने के लिए बोला तो मैंने पी लिया, मैंने फेल हो गया, एग्जाम ने मेरे को जबरदस्ती फेल करवा दिया, मैंने ठीक से प्रिपरेशन नहीं ले पाया, मैं बहुत बुरा हूँ। सो ब्लेमिंग समबडी, मे बी सेल्फ, मे बी अदर। प्रोसेसिंग ऑफ ए रिलैप्स, जब रिलैप्स होता है हम लोग ढूंढते हैं रिलैप्स के कारण क्या है। तो कौन सी टाइम, इज इट ए टाइम फैक्टर, accompanying person, occasion, place, etc. सब्सटेंस यूज विद अदर्स, कैसे करोगे, रिस्क फैक्टर पहले असेस करना है। देन रिवॉर्ड, कोई भी सब्सटेंस यूज का मेन बात यह है, ड्रग क्या है, ड्रग का 2 पर्पस है। जब सब्सटेंस आप छोड़ते हो तो सब्सटेंस ना लेने के कारण विथड्रॉल सिम्टम होता है, जैसे नींद नहीं आता है, पर्सपिरेशन हो रहा है, पसीना हो रहा है, थरथराहट हो रहा है, एंजाइटी हो रहा है, घबराहट हो रहा है, पैल्पिटेशन हो रहा है, हेडेक हो रहा है, बॉडी एक हो रहा है, स्नीजिंग हो रहा है, नेजल सिक्रेशन हो रहा है, आई रेडनिंग हो रहा है, नींद नहीं आ रहा है, इरिटेबिलिटी हो रहा है, बात बात में चिढ़ जा रहा है, तो ये सब होता है। हम लोग दवा देके ये विथड्रॉल सिम्टम को कंट्रोल करते हैं। कैसे? ये विड्रॉल सिम्टम यूजुअली अलग अलग सब्सटेंस में अलग अलग दिन रहता है। जैसे अल्कोहल में यूजुअली 10 to 14 डेज, उससे ज्यादा नहीं रहेगा। कैनाबिस में 5 to 7 डेज, उससे ज्यादा नहीं रहेगा। ओपियोइड में 15 to 20 डेज, एज मैक्सिमम एज 1 मंथ, उससे ज्यादा कभी नहीं रहेगा। तो इतना दिन हम लोग विड्रॉल मैनेजमेंट के लिए कुछ बेंजोडाइजेपिन टाइप का चीज, कुछ पेन किलर, इस टाइप का चीज हम लोग यूज करते हैं। देन नेक्स्ट फेज, दोबारा ना पी जाए, पीने की मन करता है तो क्रेविंग बोलते हैं इसको हम। तो एंटी क्रेविंग कुछ कुछ मेडिसिन है, जैसे एकाम्प्रोसेट, जैसे नैल्ट्रेक्सोन। इस अल्कोहल में एंटी क्रेविंग के हिसाब से आपका इच्छा थोड़ा सा हल्का सा कम हो जाता है, मगर पूरा कम नहीं होगा। Rest depends on your wish. If you wish, you can restart. If you wish, you can stop it. Then reward giving event in your life, that has to be increased. Like your hobbies. If you have multiple hobby, it would be beneficial to get rid of substance. If you have good friend circle, if you have good relatives, if you have good friends, maybe boyfriend, girlfriend, your wife, your husband, your other relatives, your colleagues, your boss, then it is easy, because you will get more rewards from them in other activities. Next is repetition. Repetition of motivational message, this type of message is required. And most important, if you experience enjoyment from other activities other than substance, then the person will get rid of it. But if he is not able to get enjoyment from other activities like reading, like competing, healthy competition, like exam, attending exams, scoring good marks as a students, getting praise from the students, I mean teachers and friends and parents. If you are enjoying playing, if you are enjoying drawing, if you are enjoying uh, your other activities like uh, gardening and other hobbies, then probably you will easily get rid of it. So inculcate your hobbies and enjoying behavior other than substance. Then substance would not give you much enjoyment. So I hope it would help you to help another person who is in substance. So with this, I am ending this presentation. I am novice in this software. So I want to have some questions from you. In which form I don't know. There is an option questions. I don't know how to get it, or chat. If anybody has any question, please ask me the question. Sir, we are able to hear you now. Okay. Yes, sir, we can hear you now. Thank you, sir. Sir, here are slides. Can share. Miss 30 minutes of lecture. You were muted. Okay. Sorry, I was first time I'm using it, and it is in my house. Nobody was there in my office, so I didn't get any chance from other. I'm extremely sorry. So next time it would not be repeated from my side. I ensure you. Uh, Next two class, uh, I will have the next consecutive two class. Hope next time it would be okay. Now I can understand how to chat with you. You have tried your best, but I'm extremely sorry I could not do it. Handouts, how to respond it, don't know. In the chat box you can write. Is absolutely okay, sir. The second half of the lecture was very nice. If you have any question, because time is there, so it would be very nice to see your questions. Can I hear you? That is a big problem. Chat. Better you write your. We cannot unmute ourselves. Okay, okay, okay. So you write your question. You write your question. Whatever you are writing, I can see now. I am little bit educated now. Please write your question. Anybody wants to ask any question, please. Otherwise ये उतना मजा नहीं आएगा. Please try to write. When do I say that social drinking has turned into addiction, sir? Very good question. Nice. You can write one after another. I will answer you one by one. One is social drinking. मेरा दोस्तों के साथ हॉस्टल में बैठता हूँ, पीता हूँ once a month. कोई बात नहीं. एक दोस्त का शादी हुआ, कर दिया. दूसरा दोस्त का बच्चा हुआ, फिर पिया. मैंने एमडी पास किया, फिर पिया. दूसरा एक एमडी फेल करने के पास पास किया, फिर पिया. एक एमडी में फेल हो गया, एमबीबीएस में सप्ली आ गया, फिर पिया. कोई प्रॉब्लम नहीं है. पीने के चक्कर में अगला दिन सुबह में मैं वेबिनार अटेंड नहीं कर पा रहा हूँ, शाम में हेडेक हो रहा है, रात में मारपीट किया दोस्तों के साथ, फादर ने फोन किया था, उल्टा सीधा बोल दिया, तो हर जगह से लॉस हो रहा है. फिर जाके एक एडल्ट आदमी, मान लो आप लोग जैसे नहीं हो, फैमिली वाला आदमी है, ऑफिस नहीं जा रहा है, बहुत सारी इंपल्सिव एक्टिविटी कर रहा है, दारू पी के शेयर मार्केट में जाके पैसा उड़ा रहा है, गैम्बलिंग कर रहा है, पैसा उड़ा रहा है. फिर going to market, having some motor vehicle accident, getting into trouble with the police during the intoxication stage. So these are the signs that you are addicted. मुद्दे की बात यह है, if you feel that your functioning is impaired, then it is a problem. It is definitely a problem, and then it is addiction. If you cannot control it yourself, sometimes you are controlling, sometimes you are not. The big problem is this part. As a patient, one cannot understand what is control. वो तो बताएगा एक दिन तो नहीं पिया था, दूसरा दिन पी लिया, मेरा बीबी मेरे को खराब बिहेव किया तो मैंने दोबारा पी लिया, ऐसे ही चलते रहता. तो इसमें क्या होता है, ब्लेमिंग गेम चलता है. इस ब्लेमिंग से किसी को कुछ नहीं मिलने वाला. इसलिए if you cannot cut down, if you cannot stop yourself, despite seeing that your liver enzyme getting deteriorated, your functioning is getting deteriorated, and you are scoring less and less in your exam, you are earning less and less money, you are fighting more and more people, and you are getting involved into the police and other social activists because of your behavior, that means you are addicted. Any questions? Any more questions? It was a nice. Mr. Nilay Sharkar. Yes. Next question is what to do with craving and withdrawal. Yes, craving is there. देखो भाई, क्रेविंग ऐसा है, मेरे को पीने की इच्छा होता है. दिस इज इटसेल्फ ए blame to God, blame to the maker who made me. भगवान ऐसा मेरे को बनाया, मेरे को इच्छा करता है तो मैं क्या करूं? So it is craving. Again it is a blame. Then withdrawal symptom होता है, बॉडी पेन होता है, perspiration होता है, घबराहट होता है, हेडेक होता है, इरिटेबिलिटी होता है, बात बात में चिढ़ जाना, नींद नहीं आ रहा, concentrate नहीं कर पा रहा हूं. These are withdrawal symptom. If you have withdrawal symptom, definitely you are addicted. Take the help from doctor. Doctor will prescribe some medicine for few days. Withdrawal symptom will be recovered. And regarding craving, it is beautiful topic. What is craving? Sometimes you feel अभी 154 अटेंडेंस है. मेरा बिलीव है कम से कम इसमें 5 आदमी आप लोग हो जिसको मिठाई देखने से रोका नहीं जाता. कम से कम इसमें 50 आदमी ऐसे हो जिसको गोलगप्पा देखने से रोका नहीं जाता. दिस इज कॉल्ड क्रेविंग. क्रेविंग अगर बनाना है तो अच्छा चीज में बनाओ ना. क्रेविंग अगर बनाना है then go for some healthy thing like enriching your hobbies, good relationship, creative things. Read something, write something, draw something, have some fun with friends in healthy way, like this. So obviously craving and withdrawal is a big factor for maintaining the addiction. For craving, there are some medicine which is not that effective, but there are some techniques which is effective. And for withdrawal, there are some good medicines. Any other questions? Please share. And if Dr. Nilay is not satisfied, you can write again, please. We have enough time to discuss any question, any sort of question. It is encouraged. I always ask my students to ask me question, otherwise मजा नहीं आएगा, ना आपको ना मेरे को. बहुत सारी एडिक्शन है. आई नो सब्सटेंस यूज से ज्यादा एडिक्शन है दूसरा चीजों में. सॉफ्ट एडिक्शन लाइक seeing movie, seeing pornography, then shopping addiction. These are more frequent. इसके बारे में क्वेश्चन पूछ सकते हो. आप क्या आसपास में हो सकता है? हाँ. Again, is there any threshold dose for addiction? Sir, can I one drug lower threshold of addiction for other drug? You have two questions again, Mr. Nila. First one is threshold dose. आप बता सकते हो कितना स्पीड में गाड़ी चलाना सेफ है? ऐसा कुछ नहीं होता. आप 20 स्पीड में 20 स्पीड में अगर आपका कार चला रहे हो तब भी भयंकर एक्सीडेंट हो सकता. जब अगर 200 स्पीड में चला रहे हो तब भी भयंकर एक्सीडेंट हो सकता. मगर चांसेस ज्यादा है 200 में, 20 में नहीं. मगर 20 में भी हो सकता. मगर एक क्वेश्चन है मेरा, अगर 200 चला रहा है एक आदमी और एक आदमी 20 में चला रहा है, एक्सीडेंट किसी में भी नहीं, देन बोथ आर गुड, बिकॉज 200 में जल्दी पहुंच जाएगा, उसको जरूरत भी है. सो देयर इज नो थ्रेशोल्ड डोज. इफ योर फंक्शनिंग इज impaired, definitely the dose is more. But one thing is dose at one time. Yes, there is a threshold dose for one-time use. Say for example, if you are taking alcohol or opioid or cannabis and you are getting drowsy, you become unconscious, you become violent, you become abusive, that means it is overdose. But there is no milligram dose or gram dose like this. It is available in forensic medicine, but clinical medicine, it is not. Next question is, can one drug lower the threshold of addiction for other drug? Can one drug lower the threshold for other drug? Addiction for other drug. Usually, what happens? If I take anxiolytic, say for example, benzodiazepine, alprazolam, then I need not to take cigarette or alcohol. So I believe in that respect, yes, it affects the addiction of other. But end of the day, you will land with some substance or other. So better to avoid any sort of substance. मैं यही बताता हूँ हर पेशेंट को कि अल्टीमेट एम क्या है. दो एम है. एक है मैं दारू नहीं लेता हूँ, मैं सब्सटेंस नहीं लेता हूँ, तो मेरे को ये सब परेशान करता है. उसके लिए हम लोग है विड्रॉल हटाएंगे. दूसरा है मेरे को मजा लेना है, तो मजा लेने के लिए दुनिया में इतना कुछ है, उसमें क्यों जा रहा. बहुत कुछ है अपने में ही, अपना बहुत सारी मजा लेने की चीज है. जब बच्चे थे तब तो मजा नहीं लेते थे, तब भी लेते थे मजा. वही सब चीज दोबारा लो. जब स्टूडेंट थे, जब अर्लियर एज में थे, जब सब्सटेंस लेने के पहले लेते थे, वही सब चीज का दोबारा. इट वुड बी गुड. So I think I got another question from Mr. Shorab. Sedative threshold decreases in chronic alcoholic. Sedative threshold decreases in. Probably you want to say decreases. I could not understand the question. Sedative threshold decrease in chronic alcoholic. It may be that what you are asking कि बेंजोडाइजेपिन सिडेटिव उतना अच्छा से क्रॉनिक अल्कोहलिक को काम नहीं करता. वो बोलता है एक दवा से कुछ नहीं होता, मैं तो पूरा बोतल पी जाता हूँ, पूरा खंबा पी जाता हूँ, तो मेरे को एक डायजेपम 10 मिलीग्राम में नींद नहीं आता. शायद ऐसा बोलना चाह रहा है मिस्टर सौरभ. sedative threshold, yes it happens, yes it happens, and that is the reason why जो सब्सटेंस नहीं लेता है, जिंदगी में पहला बार डायजेपम 5 मिलीग्राम लिया, वो 3 दिन सो गए, 3 दिन उठ ही नहीं पाया बिस्तर से. और एक आदमी जो अल्कोहल पीता है, उसका 25 मिलीग्राम 3 डिवाइडेड डोज में दिया, कुछ नहीं हुआ, अच्छा खासा घूम रहा है, लोगों को गाली दे, एब्यूसिव बिहेवियर कर रहा है, इंटॉक्सिकेशन स्टेज. ये भी होता है. क्रॉस टॉलरेंस बोल के एक बात है कि एक नशा कोई आदमी कर रहा है और दूसरा नशा के प्रति उसका टॉलरेंस डेवलप कर रहा है. कम में नहीं होगा, ज्यादा चाहिए उसको. Probably Mr. Saurabh is asking something like this. If it is not satisfactory, please reframe your question. Any other questions? We are left with 8 minutes more. It is pleasing to me for answering your questions. Please ask more and more questions. Yes, I got another question from Shakshi. Sir, if a patient is addicted and has a local supply of drug from neighbor and cannot afford to change his house and thus cannot avoid the supply, should we advise de-addiction treatment knowing that the relapse would always occur when he goes back home at work? Yes, very nice question. Probably Miss Sakshi has faced such thing in his life or in some patient's life. Uh, Very nice question. Everybody should read this question. What she is asking कि किसी का घर के बगल में ऐसा माहौल है जहां पर दारू मिलता है, गांजा मिलता है, ओपियोइड मिलता है, वो बेचारा घर चेंज भी नहीं कर पा रहा है, उतना अफोर्डेबिलिटी उसमें है नहीं, बहुत सारी प्रॉब्लम रहता है, आप तुरंत घर चेंज नहीं कर सकते, तब क्या करोगे? दिस इज द क्वेश्चन. And thus cannot avoid the supply. Should we advise de-addiction treatment knowing that yes, de-addiction treatment कर सकते हो, सप्लाई नहीं हो रहा है, सप्लाई होने दो, सप्लाई होने दो, मेरा घर के बगल में भी मिलता है, मैं नहीं पीता, नहीं तो मैं पीता, दोनों ही तो हो रहा है ना. अब तज्जुब बन जाओगे, ऐसा बहुत लोग हैं जो दारू का दुकान में काम करता है, दिन भर दारू बेचता है, कभी दारू नहीं पीता, उसके पास तो सप्लाई है, वो चाहे तो पी ले, सस्ता में मिलेगा उसको. बहुत सारी रिच पर्सन है जिसके पास बहुत पैसा है, दे कैन बाय, स्टिल दे डू नॉट टेक इट. लर्न फ्रॉम देम because they are also enjoying their life. So enjoyment in life and getting rid of your दुख, आपका फ्रस्ट्रेशन, आपका फेलियर, दूसरा रास्ता है, वही रास्ता सीखना पड़ेगा. दूसरा कोई पिला दिया तो मैंने पी लिया, ये तो ब्लेमिंग गेम, इससे कुछ नहीं होने वाला. इसलिए वो जो स्टेज मैंने बताया था, इफ यू वांट टू एक्ट पॉजिटिवली, दैट मीन्स I want two things. One is I will stop the substance intake, but still I want enjoyment. This should be the target. Then whether the substance is available around you or not, it doesn't matter. Another thing is sometimes it is difficult to say no. If your friend is saying, as a lady, take one cigarette and you will enjoy. I have seen so many patients, lady patients, they are smoking, they are taking ganja, even heroin. In that case also, whether it is male or female, it doesn't matter. So saying no to your relatives, your friends in social gathering, like शादी में गए हो, सब लोग पी रहा है, दोस्त बोल रहा है, इवन फादर कभी कभी बोल देता है, अरे एक दिन पी ले, कुछ नहीं होगा, आज अच्छा मौका है, पी ले, पी ले. Saying no is an affirmation in life, assertiveness in your life. Sometimes you have to learn how to say no, even if it is available around you. I think I have answered your question. If you are not satisfied, write again. We are left with some more questions. Thank you, Shakshi ji. Any other questions? And I believe the attendance would be automatically done, or I have to do something else. Can anybody help me? My colleague earlier, he told me it is automatic. Probably it is automatic. I don't know. So next time I will be there. So in the chat, okay, thank you. It is automatic. And in the chat, next time I request you, please guide me. I'll open the chat file so that I can be guided. Because this time I don't have any idea how to chat. You have tried your best to communicate with me, but I was very novice in this field. Anyway, thank you very much. If you have any question, please. Otherwise, I am leaving. Thank you for listening me, everybody, and help the other people. My request to you, help the other people who are getting into it. Maybe your brother, maybe your sister, maybe your colleague, maybe your friends and all. If you have any doubt, any problem in your personal life, please contact me. And obviously not in OPD, because it is a very busy place. I may not attend it. So if you have any question, no. Thank you. I'm leaving. Thank you very much. End concept. Stop recording. Show screen. So you can people.